Or I think that Botox is now a very popular injectable in America, that the growth of its use has been really exponential in the last decade. So it shows that it's been very safe. Now, what about the new fillers that we have? We have a whole range. We have the hyaluronic fillers, and then you also have fillers where you use the patient's own fibroblasts. Tell us a little bit about that.
Right. So, as these technologies have evolved, we're kind of transitioning towards some more biological therapies as well. So the one you're referring to is called Invasive, and it uses the patient's own fibroblasts. And the process involved with that is we take a little biopsy of skin from behind the ear, and we send it to the lab, and the lab then kind of cultures the patient's fibroblasts, replicates them, and then prepares them for injection. The thought is that the use of the fibroblasts can help the formation of new collagen, which is ultimately the goal because that can kind of prevent the need for repetitive treatments. The other option is using fat injections, and the fat can be harvested from the patient, processed to try and maybe potentially gather some of the stem cells or the kind of stem cell modulators and re-inject that for volume as well.
Now, if you grow the little biopsy behind the ear, how long does it take to grow the tissues before you can actually use it in the patient?
It can take up to 11 to 22 weeks, so it's not something you can walk in and get that day.
And the same thing about the fat. Where would you get harvest the fat?
We can harvest fat anywhere the patient likes, and then that's harvested and injected at the same time.
Okay, so that's immediately at your office?
Or at a surgery center.
At a surgery center.
And how long would that procedure take?
It depends, but it probably takes about 60 minutes.
And is there a lot of sort of scarring or potential side effects to using injectables or using your own fat or even the industrial made material?
With any procedure there's a risk of complications, but we minimize those by using best practices. The most common complaints are kind of maybe some mild bruising, injection site redness, just where the needle goes in, you see kind of a spot of redness which goes away in 24 to 48 hours. And with, if you're harvesting fat, you can get bruising from the area where you took the fat from. So, the risks of the procedures are all relatively minor.
If people want to use their own fat to sort of fill out their cheek hollows or something, you need a certain volume. So that could be, so a person, that would be hard to find a place to harvest without a scar?
Well, we harvest it using liposuction. And so the scar is typically, maybe 3 or 4 millimeters in length. And we can conceal those scars in areas that are usually concealed by clothing, so in the bikini line or something like that. So, to harvest from either the thighs or the abdomen. So it's very inconspicuous.
So that's less than ½ an inch. That's a very small scar.
It is. It is a very small scar.
Now, what is the other injectables that you use for various other things? Let's say for somebody in their 20s where they have minimal crow's feet and they use an injectable, what would they choose? Say a 24-year-old starlet, what would they choose? And how often would they come?
I think it depends on what they're looking for, but in the 20 to 25-year range, which is relatively young to start having procedures, but people of that age, if they have an area of concern, might be they want a little bit fuller lip, or they want to prevent the formation of wrinkles either in the brow, kind of the forehead frown area, or right around the eyes. And typically the dosages would be lower because they don't have as much kind of concern or wrinkles in the area.
So then more, I guess the age 30, the third decade is where you see more patients, where you get more people who come in because there are more frown lines present.
Yeah, I think, I was a child once and I'm sure I caused a lot of frown lines in my mother, but I think definitely at that age group there's more wrinkles and more wrinkles to treat in the frown area and the crow's feet. And typically Botox or Dysport is injected every 3 months, and the dosages vary by the patient.
Okay. And so that people would expect to go sort of maintenance a few times a year.
Yeah, I think that's pretty safe to say, 3 to 4 times a year.
And then in the fourth decade, after people have had babies, because sometimes when women have had children, they gain weight and lose weight in their face. So there's, associated skin changes. And what are those big issues then?
Well, I think as you gain and lose weight and there's more skin laxity in the face, then it needs to be treated with a combination of maybe volume and surgery. So volume would replenish the volume, so you could use any of the hyaluronic acids that we talked about, the Sculptra that we talked about, fat injections. But also if there's excess skin, then you might need to have some surgery to remove that. I think the most important thing, every patient who comes into the office is worried that they're going to look different. Everyone wants to look better. Nobody wants to look different. And I think the key is, judicious or prudent use of all the different modalities of therapy, and not to overuse one in lieu of something else.
Now, men also have been coming in for these minimally invasive procedures for the face. What do they ask for, males?
I think male aesthetics is a little bit different in that the areas of aging are a little bit different. The things they ask for might be a little bit different. But typically males also get crow's feet. I think the frown lines are not as much of a concern, but sometimes they are. And also a typical concern for a male sometimes is kind of in the cheek area where the lower lid is.
Also, men are lucky because they have the facial hair for shaving that keeps their skin young. It sort of like, helps their skin thickness. So they probably also come in for Botox injections to reduce the frown lines.
Yeah, they do. Men probably represent 10 to 15% of the people who are getting injections for the face. And that's actually a growing segment of the market.
Now, there's also something called skin resurfacing. Do you do that too?
We do. There's different types of skin resurfacing, and skin is one component of facial rejuvenation, and so it requires a combination of skin care and also possibly resurfacing. Resurfacing can be done with a peel, which is use of a chemical to kind of upregulate the skin and get rid of some of the fine wrinkles. And you can also use laser to do that, and the laser would kind of induce a superficial, a very light burn to the skin, so to say, to get the skin to heal and thicken the collagen.
And we see on TV a lot of these movie stars who are getting plastic surgery, and sometimes, feel like you can tell that they've gotten it. Is that sort of a concern for patients that after they get a small procedure, you can really tell that they got it?
Yeah, like I said before, nobody wants to look different.
Yeah.
Everyone wants it to look subtle. They just want to look refreshed. And I think the key to that is being judicious in how much product you use, and being cognizant or knowing the anatomy very well so that you don't overdo it and make somebody look funny.
And you said you can't really replace one certain type of, maybe if you need surgery, you can't just get too much filler to replace.
Yeah, if you look at a lot of the Hollywood people, the people who really look funny are the ones that overdid one thing. You see the people who get too much fat injected, their faces turn very round. Or, maybe they did that because they didn't want surgery, or maybe they went to a practitioner that didn't do surgery. But in any case, you don't want to overdo any one thing. People worry about getting a frozen face with Botox, but I think if you use too much Botox, yeah, you will definitely get a frozen face. So the key is to use just the right amount.
Everybody's concerned about Hollywood because there's a handful of stars that tend to get a lot of publicity, but when people are told the number of injections are actually done on a national basis, people are amazed that there's over 10 million Botox injections done in this country every year, and that number may even be underreported. So there's probably more people walking around who've had it that you probably don't notice that look very natural, as opposed to the small handful in Hollywood that tend to populate the magazines and TV shows.
So the key is to have the minimally invasive techniques so it's natural and enhancing rather than radically different from point A to point B. So when you get patients in, what do you tell them? What are the typical questions they ask you? Because you actually have to steer them to the correct path.
Well, commonly patients will come in with a specific complaint, and I think that's the most important thing to listen to, because if you don't do anything else, you have to listen to the patient and treat what concerns them. And I think as a physician, your role is to make sure that they're not doing something, wrong is not the right word, but something that is kind of bad for them long term. And as long as that is fulfilled, then you're okay. Now, often the patients will ask, well, what else? And when they ask what else, then we'll go into, well, you can look at this